Hi, my name is Allison McGee, and I'm currently a QMHP and I provide behavioral health services to children within the foster care system that currently reside in a residential treatment center. One of the biggest issues that I find when working with children in the foster care system is their lack of mental health services provided to them. In 2019, the National Conference of State Legislators reported 80% of children in the foster care system are not receiving adequate care and have been diagnosed with a severe mental health disorder. According to Vreeland 2020, one of the biggest issues when providing mental health services is disruption of placement. This is when a child is moved from wherever they're put due to externalizing and internalizing symptoms. According to Oakside and Courtney in 2018, a study found that a number of placements within the foster care system was correlated with increased risk of poor mental health outcomes. In order to decrease the number of placement disruptions, Judith Cohen in 2017 details in her book a trauma-focused CBT method. This method incorporates the child and the caregiver. It teaches the caregiver how to help the child reduce those internalizing, externalizing symptoms. It creates a bond and it helps reduce number of placement disruptions. In a study published by Dorsey and co-authors in 2014, TFCBT was implemented with foster care parents and foster youth, and it was found that the intervention can significantly decrease PTSD symptoms, depression, anxiety, internalizing, externalizing symptoms, and help the child stay in a stable home. By providing a stable home, it can create the longevity of care provided by their assigned mental health professional. Another major issue for children in foster care when accessing mental health services is the lack of mental health services provided under the coverage of Medicaid. In an investigation published by Janet Cummings, it was found that the majority of psychiatrists practice in solo or group office settings, but only 3 to 8% have a caseload that are covered by Medicaid. A lot of the times, mental health providers who participate in Medicaid are found in hospital settings and specialty community-based mental health clinic settings that typically provide outpatient services. This is not only a problem for the majority of the population, but for children within the foster care system who have a severe mental health disorder. This is a significant problem in accessing proper mental health care. A way that we can help compensate for the lack of mental health professionals that provide coverage under Medicaid is maximizing the use of behavioral health organizations that provide Medicaid coverage. By increasing enrollment and outreach and renewal of enrollment, we can create longevity of care, an increase in mental health services, and provide services needed for the population, such as children in foster care, with the adequate care that they need to live a healthy lifestyle and continue decreasing those internalizing, externalizing symptoms, and reduce placement disruptions. Lastly, a third problem that kids in the foster care system face when accessing mental health is their lack of skills regarding how to schedule appointments, information regarding psychoeducation, information regarding community outreach programs. All of these independent living skills can be provided, according to Sakai in 2014, by transitional support programs that can help youth manage logistical issues, including appointment scheduling, changing their contact information, looking for outreach programs. And so by increasing the teaching of independent living skills, we can help them gain their knowledge to access the proper mental health care that they need. Overall, the biggest problem that we see with children in foster care is the stability issue. By increasing the longevity of care, whether it's by behavioral health services or transitional youth programs or decreasing placement disruption, by increasing that longevity of care, we can reduce the mental health issues that we are seeing consistently in children in foster care. By doing so, we can offer significant mental health services to help them live a healthy lifestyle and be active members of society. Thank you so much.